Panniculectomy and abdominoplasty are some of the more common procedures we perform for body contouring of the abdomen. Panniculectomy procedures are often done after massive weight loss, and the goal of a panniculectomy is to remove the roll of skin and fat from the lower abdomen below the belly button and take away the fold that often gets rashes or ulcerations. An abdominoplasty starts off the same way, but is more of a cosmetic procedure, and that involves contouring the entire abdomen, tightening all of the skin, and typically moving the belly button as well. In addition, an abdominoplasty can involve liposuction or additional scars to tighten the upper abdomen. So let's talk about who is eligible for a panniculectomy or abdominoplasty. For a panniculectomy, there are certain criteria that insurance companies require to be met. The first is that they require significant weight loss. If you've had bariatric surgery or if you're using diet and exercise alone, we typically require people to have a body mass index of 30 or below, although there is some wiggle room to that. We like to see patients have a stable weight and sufficient time to have elapsed following their bariatric surgery, and that's typically in the region of about 6 months to ensure that you've reached your base weight. Finally, insurance companies will often require certain conditions to be satisfied, such as patients having intractable rashes or ulcerations or infections underneath the abdominal skin fold that can't be treated with routine treatments and require this kind of surgery. As part of planning for your surgery, you will be meeting with your surgeon and possibly their physician assistant. The first step of meeting with your surgeon is running through your medical history. Your surgeon's going to focus on things like medical conditions that require management around the time of surgery. This might be problems with your heart or lung or kidneys that require us to optimize those issues. This is going to require a discussion of your medications, things like blood thinners that you might be on or steroids that could affect surgery. And finally, they're going to be interested in other operations that you've had that may change what options you have for body contouring surgery. Your surgeon's also going to go through a thorough examination of you. They need to know your current weight, and they need to know where your weight will be in the future and what your plans are for any further weight loss. They're going to look at scars on your abdomen, both to determine how your body scars, but also to see where they are, because that can affect the way that we do the surgery. They're going to want to look at the amount of skin laxity and the amount of fat that you have underneath the skin, because again, that can change the way we do the surgery or some of the nuances about how we do this operation. And again, they're going to be looking at hernias inside the abdomen to see if there's a hernia that either needs to be fixed or could create a problem if we go ahead with the surgery. Finally, they're going to be looking at things like rashes and symptoms of this, which may need to be relayed to your insurance company, and rectus diastasis. That is the separation apart of your tummy muscles, which often needs to be brought back together when we're doing abdominal contouring surgery. Your surgeon will talk to you about your various options, what types of surgeries they can do, where the scars may be, and also the risks and benefits of surgery. There are risks with all surgery we perform, and in this operation, some of those risks include bleeding that could require a transfusion, infection that may need antibiotics, how we will manage your pain afterwards and the type of pain you may have, scarring, including the type of scarring and location of scars, and possible revision surgeries that could be needed. There are more serious but rare complications like heart problems, blood clots in the legs that can travel to the lungs, or anesthetic complications. Finally, for women who are not up to date with mammograms, we typically ask them to get back up to date with mammograms, because the abdomen is one of the tissues we can use to reconstruct the breast should that be needed if a patient has breast cancer and requires a mastectomy. And we want to make sure that you're up to date with the mammogram so that doesn't catch us by surprise. There are a number of things that need to be organized ahead of surgery. The first, and perhaps most important from an insurance point of view, is prior authorization for insurance cover procedures. This will be the case for many panniculectomies. It may not be the case for an abdominoplasty. You should know that there are several important things. First, there are variable criteria between insurance companies, and different insurance companies may need different criteria to be met before they will approve this kind of surgery. It may take between 2 weeks through several months to get an insurance company to approve this kind of surgery, and they may require additional documentation such as photographs, dermatology notes, or lists of medications and prescriptions that you're using. For this reason, it's very helpful to bring in as much information as you possibly can at your initial appointment to help avoid denials. So this would be things like prescriptions of medications you've used or notes from other providers. Your own insurance will determine the co-pays and co-insurances and deductibles that will be required for you to cover yourself. It's important to know as well that certain cosmetic procedures or parts of procedures are not covered by insurance. So typically an abdominoplasty is not covered by insurance, but a panniculectomy may be. When you see your physician, they will be able to give you a quote for what any cosmetic procedures may cost. You will talk to them about the decision to proceed and the discussion of various options, risks, benefits, etc. After your appointment with the physician, you'll be able to schedule with the administrative staff for either another visit or potentially surgery if you're going to proceed with that. And before surgery, you'll be meeting with the anesthesia team. Details of where to come on the day of surgery and exactly what to bring with you and who to bring with you will be provided shortly before surgery date. On the day of surgery, a number of things are going to happen. You'll have been given instructions where to come on the day of surgery, and you'll be led down to our preoperative waiting area. There, a number of things will happen, including marking, which your surgeon will do to show where the scars will be and mark any important areas on the body. The anesthesia team will bring you back to the operating room where you'll be put under general anesthesia, where you'll be completely asleep for the entire case. Surgery will take anywhere between 1.5 and 3.5 hours, and typically you'll wake up with a firm Velcro binder on and possibly drains in place. Depending on the type of surgery, you'll either stay with us overnight or go home the same day. Before you leave, a number of things are going to be arranged with you. The first is that the staff will be speaking to you about pain control. That ranges anywhere from Tylenol all the way up to narcotics. They may need you to pass urine before you go home to ensure that you're doing okay from that point of view, and the nurses will run through any other instructions with you. They may also arrange a visiting nurse to help you with any drain care and make sure that you're doing okay daily after surgery. They will give you a binder that you'll wear at all times. That's a Velcro waist strap that you'll wear at all times to put pressure on the area. Your surgeon will go through with you whether it's okay to shower depending on how they've done the surgery. And afterwards, they'll ask you to arrange an appointment between 1 and 2 weeks after surgery for a check-in. There are several restrictions that will be in place on you. The first is to avoid heavy lifting. So most of us prefer patients not to lift more than about 10 pounds for several weeks, even up to a couple of months after surgery, and also to avoid core exercises and very strenuous activity for the weeks after surgery. Your surgeon will typically run through with you the exact restrictions on you depending on exactly how they do your surgery. We're happy that you're considering us for your body contouring surgery. There are, of course, unique things about you that you may want to discuss with us. We'd be happy to discuss those at any time. Thank you.